Hello and welcome. Thank you for joining me for today's information session on long-term care facilities, viruses, and the new normal. My name is Sean Rollo, and I am the Technical Director for OrkinCanada. By now, most understand the impacts that COVID-19 has had on human health, with global cases now over 9.2 million and deaths rising above 475,000. In the United States, 2.4 million confirmed cases and over 122,000 deaths. And here in Canada, we've now crested over 100,000 confirmed cases and 8,453 deaths. This is not something that we've seen in our lifetime and not since the Spanish flu outbreak in the early 1900s. It is an extremely stressful and unprecedented times for everybody involved. It's had a tremendous impact not only on human health, but also on businesses. For long-term care facilities, it's taken a major toll on their ability to serve their residents and look after their employees. It's an unprecedented and extremely stressful time. One of the most important things that we can do is minimize the potential spread of COVID-19. But how exactly do you prevent the spread of a virus? There are a lot of ways that we can look at this, and one is to just go to the extremes. Closing down of businesses and facilities, and that's something that a lot of countries, including Canada, adopted early on in the COVID-19 outbreak and has proved very fruitful in flattening the curve. However, it's not practical to continue in that manner for long durations of time. As things start to now open up, we're seeing that businesses are operating a little bit differently, but they're operating. The other extreme, of course, is hazmat-like suits and no interaction whatsoever. And there is a middle ground between these two extremes. And so we're going to talk a little bit about what some of that middle ground involves. One is cultural change. So mitigating the transmission of COVID-19 by changing the way we act and behave. And the catchphrase or the terminology that we hear a lot now in the news is social distancing. There's a mathematical model here on the screen showing that a person infected with COVID-19 going about their daily routines, going to work, having social interactions, going to the grocery store, is likely to transmit COVID-19 to over 406 people within a 30-day period of time. By implementing social distancing and reducing those interactions by 75%, that same person that was infected on day one would only have infected 2.5 people after 30 days. The numbers are dramatic. And so cultural change certainly works. Social distancing works. It is flattening the curve. So when we say social distancing, things like maybe working from home and only going out for the essentials, staying more than 6 feet apart. And while this might work for a number of people in society, it may not be practical for long-term care facilities. Within long-term care facilities, residents often would group together for activities, both for physical health as well as mental health. And so they're adapting as well to how they're interacting with the residents. Classes like this that you see on the screen may not be happening now due to social distancing, and thus they're one-on-one or solo type classes. Residents themselves are not able to interact with each other. They're having to stay at least 6 feet apart in social distance. The impact that this is also having on loved ones is quite dramatic. People not being able to come and visit their loved ones that are in long-term care facilities can be devastating, not only for those loved ones, but for those that are a resident of a long-term care facility themselves. We can look at mitigating transmission through personal protective equipment. And for a long-term care facility, all of the personal protective equipment pictured here are probably in use. Gloves and gowns, face masks or goggles, and one or more types of masks, whether that be surgical or N95. I want to talk a little bit about the differences between some of the masks that are out there. Here we can see in this particular photo of a long-term care facility, they're gowning up with hairnets, and you can see two different styles of masks. We have an N95 mask with the gentleman facing the camera, and the lady that's facing him is wearing a surgical style mask. So this particular facility has adopted two different forms of mask, and that may be out of reasons for short supply. So let's look at some of the differences between some of the personal protective masks that are available to us. There's anything from a cloth mask all the way up to an N95. Right in the middle would be what's considered a surgical or 3-ply mask. Generally speaking, going from left to right, from cloth through 3-ply up to N95 offers better filtration of particles, of which a virus is considered. And so by better filtration of particles, there should be the ability to help prevent the transmission of COVID-19. There's a lot of research being done on masks in general and viruses, and a lot of research papers that are starting to emerge. Some are suggesting that cloth masks are very effective. Some are saying that maybe not so effective, and it really depends on the materials that they're made out of. And a cloth mask may not fit as tightly as some of the others. And so it's important to do your research before choosing the style of mask that is right for your facility. There's disposable masks, such as a 3-ply or surgical mask, as well as the N95 mask. So choosing the right mask is certainly very important. Once you've selected the mask, trying to source it can also be challenging. The shortages of the various mask styles that are out there has certainly driven the prices up, as well as the scarcity. Choosing to use disposable versus reusable is also a consideration for your facility. A cloth mask is one that could be washed and maybe worn several times, whereas the surgical or N95 are meant to be disposable. And if you are using disposable masks like a surgical or 3-ply or an N95, is there an opportunity perhaps for reusing those? There's some really great articles on the Center for Disease Control website, as well as the World Health Organization websites, on the reusability of some of these masks that are meant for disposable use. There's also not touching your face. If you're not used to or comfortable wearing a mask, you're more prone to be touching your face, which may exacerbate the problem of trying to mitigate transmission of COVID-19. We touch our faces a lot more frequently than we think that we do. And when you wear a mask that's not comfortable, you're likely to be adjusting and fidgeting and touching your face even more so. And then wearing it correctly. In my day-to-day activities, when I go to the grocery store or if I'm out and about, I often will see people that are wearing masks incorrectly. So they'll either not have it over their nose, so it's just covering their mouth, in which case it is not being effective. Or as they're speaking to somebody, they will lower their mask so that they can speak to them and then put the mask back up, thinking that somehow their voice is not traveling through the fabric. It's important, if we're going to be wearing masks, that they're worn appropriately. And so follow the directions that come along with the masks that you choose for your facility. We can mitigate transmission through sanitation efforts. And if you're like me, you probably thought that all of these words on the screen, clean and sanitize, disinfect, sterilize, were somewhat the same, or at least we interchange them a lot in our day-to-day speaking. However, there are dramatic differences between clean and sterilize. And so as we move from left, clean, all the way to right, sterilize, we increase in cleanliness and we are decreasing the amount of germs, bacteria, and viruses that survive on surfaces. So cleaning is physically removing of germs and dirt and impurities. And this is what we would think of when we use soap and water. We're scrubbing off of the dirt and germs and washing them down the drain. Sanitize, which is something that we would associate with hand sanitizer or certain cleaning products, can lower the number of germs on surfaces by up to 99.9%. Disinfection takes that one level higher, and that's killing germs on surfaces, except for some fungal spores, at nearly a 100% rate. It's actually 99.999%. And you might think, well, geez, the difference between 99.9 and 99.999%, it's not that big of a deal. But when we're talking about viruses, where there could be millions of virus molecules on a surface, leaving behind that 0.099% could mean thousands or hundreds of thousands of virus molecules that are still there on the surface, to which can affect or infect people. So that level of disinfection is certainly important. And then we look at sterilization, and that is something we typically would associate with medical instruments or dental instruments, things that cannot have any living organism on its surface. And these will, generally speaking, go through some sort of a heating process. And so sterilization, while very effective, is not practical for day-to-day objects and activities. So what we want to achieve is from left to right, the further right we can go, the more effective we're going to be at preventing the transmission of a virus. And disinfection is where we're really trying to aim for. So that 99.999% level is extremely important. When we're looking at various disinfectants that are on the market, if you're in the United States, you're going to be referring to EPA's List N. These are disinfectants for use against SARS coronavirus 2. This is the virus that causes COVID-19. And in Canada, we're going to be looking at Health Canada's list of approved disinfectants for emerging pathogens. Both of these websites will have lists of products that they deem would be effective against the SARS coronavirus 2. Again, this is the virus that causes COVID-19. You will not yet find on product labels coronavirus 2 or SARS coronavirus 2 listed on the label. You won't see COVID-19 listed because COVID-19 is actually the disease. But you won't see the specific virus listed on the labels yet because it's just too new of a virus, has not yet gone through all of the testing requirements that Health Canada or in the United States, the EPA would require to have it approved to be printed on the label. With that said, both the EPA and Health Canada have looked at similar viruses and looked at products that are on the market that would be effective against those and made the assumption that if used as directed, they would be effective against the SARS-CoV-2 virus. It's important when choosing the disinfectant that you're looking at what are the active ingredients. How long does it have to stay in contact with the surface? So if there's a virus on a surface, there's going to be what's called a contact time. And what you want is that contact time that's going to get you to the level of disinfection that is 99.99%. Each product is going to be different. And each product label will have a main claim on typically the front of the label. It'll say kills 99.9% of germs and bacteria or viruses. But it's important that you look at the entire label and see the data table that will come with it. And typically with a disinfectant, you will have a whole list of viruses, and there may be different contact times associated with different viruses. And so with the SARS-CoV-2 virus, you're going to be looking for coronaviruses and the contact time required for that. So again, one product may be effective against a certain virus with a 1-minute contact time, but a different virus with that same product might be a 10 or 15 or 20-minute contact time. So make sure you consult your label. Does it need to be rinsed from food contact surfaces? This is an important consideration, especially for a facility like a long-term care home or residence, where there's going to be kitchen facilities and trays and tables and things that residents may put food on top of. So if you're going to be using a disinfectant for those surfaces, is it able to be applied and then not rinsed off? Or if it is applied, do you need to then go back and rinse the product off after it's had its appropriate contact time? Things that you're going to want to consider when choosing a disinfectant. Can it be applied while the business is in operation? And will it corrode any electronics or damage certain materials? Again, consult with the label as well as the SDS to find out if this disinfectant that you're looking at is right for your facility. Should you or will you take an in-house approach? Will your staff be doing the disinfection, or will you be looking for a third party, such as WorkinCanada, to come in and do a disinfection service? So WorkinCanada's Vital Clean disinfection service, we feel, is one of the best options out there. It is both EPA and Health Canada approved and applied by professionals that have done disinfection for years. It does kill 100% of bacteria and 99.99% of viruses. It's eco-friendly and has a very low toxicity. In fact, the EPA rates it as practically non-toxic. It's also a very crucial first line of defense to helping prevent the transmission of COVID-19. So consider a professional company like WorkinCanada for your disinfection needs. You'll also want to be looking at protocols, and you need protocols that are going to have viruses in mind. So looking at how to be healthy and clean, how to disinfect versus just clean. Remember, sanitizing and disinfection are two very different things. What social distancing will be implemented for your residents, for your staff, and visitors of long-term care facilities? And if there are pickups or deliveries, what is the protocol that would be involved with those? COVID-19 has become our new normal, and we really don't know what the long-term effects of it are going to be. But we do feel that the way in which long-term care facilities operate may change forever. Social distancing will likely persist for months, if not years. Personal protective equipment will be part of everyday life, and we're starting to see that more and more as we go out to the grocery store or we go out for those essentials. People are wearing masks. They're sanitizing their hands with hand sanitizer as they enter buildings and facilities, and so PPE may become part of everyday life. Remember, sanitation and disinfection are not the same thing. And when you're developing protocols, they need to be developed with viruses in mind. Thank you again for joining me today for this information session on long-term care facilities, viruses, and the new normal. My name is Sean Rollo. I'm the Technical Director for WorkinCanada. If you're seeking any further information on our Vital Clean services, please visit our website at orkincanada.ca/vitalclean, or you can call us at 1-800-800-6754.